Close to 1 in every 6 American is now age 65 or older. As the baby boomer generation continues to age, the segment of those 85 and older, the group most in need of intensive support, is now the fastest growing demographic in the United States. At the center of this demographic shift are non-profit aging services. These organizations are not just niche charities, they are an essential sector of the American economy and healthcare system. Organizations like Leading Age represent more than 5,300 non-profits and mission-driven providers that touch millions of lives every single day. This reach is massive, spanning the entire continuum of care, from skilled nursing and assisted living to memory care, affordable housing, and home-based services. Whether it is delivering nutrition via the 5,000 community-based programs or Meals on Wheels, or providing legal advocacy to fight senior poverty through justice in aging, these non-profits are the invisible backbone of our social safety net. So why are these non-profits so important? Because they fill the critical gaps that government insurance leaves open. While Medicare covers medical treatment, it rarely covers non-medical home care, meal delivery, or the daily social support that allows a person to live with dignity. Non-profits have fundamentally changed US society by shifting the focus from mere survival to quality of life. They advocate for the dementia inclusion movement and partner with researchers to ensure that aging isn't seen as a decline but a stage of growth. Beyond care, they are champions of social justice. They fight against age discrimination in the courts and build affordable housing specifically designed for vulnerable groups such as LGBTQ plus elders who face higher rates of poverty and isolation. They are the trusted voice that shapes national conversations and pushes for smarter policies that protect the most vulnerable among us. However, this vital sector is navigating a perfect storm of external pressures. The first significant challenge is a workforce crisis that has been described as catastrophic. In 2026, the average staff turnover rate remains high at 35.4%, with registered nurse turnover often exceeding 40%. This isn't just about labor numbers, it's about the emotional toll on those who serve. One study found that 76% of leaders say staff burnout actively hinders their organization's ability to achieve its mission. Furthermore, shifting immigration policies have caused deep disruptions. Because immigrants make up nearly 1/3 of the care workforce, a recent crackdown has resulted in at least 1.4 million fewer immigrants in the US compared to early 2025. Some non-profits report losing 3% of their frontline caregivers, mostly housekeepers and aides, overnight due to changes in temporary protected status program. The second major challenge is financial sustainability within a fragmented system. For most non-profit providers, the numbers don't balance. On average, Medicaid, the primary payer for long-term care, only covers 82 cents for every dollar spent on care. For non-profit nursing homes, that ratio is even lower at just 76 cents. We also face the wrong pocket problem. If a non-profit invests in a program to prevent resident falls, the savings from fewer hospitalization go to the federal Medicare program. But the non-profit provider and the state Medicaid program do not share in those savings. Compounding this is a deeply fragmented care model. Communication between hospitals and nursing homes is often broken, meaning critical continuity of care is lost the moment a senior is transferred from one facility to another. I want to quickly take a minute to talk about something that makes helping even easier. We have built a platform that can be a helping hand for non-profits. Zendonor. Empower your non-profit with Zendonor, the streamlined, secure platform for global fundraising. Connect with donors worldwide and elevate your impact. We are offering 1 year of free access to a limited number of organizations. Click the link in our bio to learn more. Now back to the video. So how do we solve these systematic challenges? Mission-driven leaders are moving beyond short-term fixes towards sustainable, innovative strategies. Number 1. Investing in people and culture. Successful nonprofits are prioritizing workplace culture above all else, even wage increases. They are building career pathways such as CNA to nurse apprenticeship programs to create a stable pipeline of future caregivers. Number 2. Technology and AI. Nonprofits are increasingly partnering with universities to design and pilot assistive robots and AI-enabled tools. These tools are meant to augment care, not replace human connection, allowing seniors to stay in their homes longer. Number 3. Operational efficiency. To combat burnout, Providers are using business process outsourcing (BPO) for non-clinical tasks like medical billing, IT, and payroll. This removes the administrative burden from clinicians, letting them focus entirely on their residents. The future of aging in America depends on our ability to reimagine the system. It requires a unified voice, data-driven advocacy that convinces lawmakers to close the funding gap and remove immigration pathways to essential workers. By integrating housing, healthcare, and technology, we can move from a system that is struggling to one that truly allows every older adult to age with the dignity they have earned. So, thank you for watching, and leave a like if you like the content that we are posting, and share this video. Even if you are a person who is not part of an organization and wants to help out senior citizen non-profits, share this video to an organization who helps senior citizen in the USA. Thank you for watching. See you next time.